So epiretinal membrane is an extra layer that forms over the back of the centre of the retina called the macula. I do think there's a lot of variability in how epiretinal membranes present. Some patients have blurred and distorted vision, and others might not have any symptoms at all. Epiretinal membrane might also be referred to as cling film or cellophane maculopathy, in part due to how it looks when you examine the retina, but also in its nature, how it adheres and wrinkles the retina. So I think that epiretinal membrane and macular degeneration are separate things. Epiretinal membrane does affect the macula, which is the central part of the retina, but those two are separate. I think that epiretinal membrane is quite a common condition, however. 1 in 100 patients has a membrane at the back of their eye. Most of the time we think that forms through the separation of the vitreous from the retina in a process called posterior vitreous detachment, or PVD. If you have an epiretinal membrane, you may have wavy, distorted or kinked vision. Sometimes this is picked up by your optometrist on examination with the grid line paper called the Amsler grid. For other patients, they have a general blurriness of their vision, and that can range from very mild to very severe. And of course, some patients may not have any symptoms at all. I would recommend that all patients that have an epiretinal membrane and have symptoms see a retinal specialist. This allows us to perform scans and examine the eye and make a plan for treatment going forward if needed, or monitoring where necessary. So ultimately, epiretinal membrane can be treated. You can choose to have surgery if you have symptoms and have a significant epiretinal membrane. The surgery is called a vitrectomy. This can be done whilst you're awake, 45 minutes lying flat on the table or asleep with a general anaesthetic. The aim of the surgery is to remove the gel at the back of the eye, peel the membrane, and ultimately give a chance of improving the vision.